Perfect. So let's get started. So welcome everyone. My name is Jordi Mullor. I am a director of marketing at Lexington Wealth Management. And when preparing for this webinar, this is like a few months ago, we were dealing with a lot of fear, not just in our office, but it was just amongst a lot of different networks and different groups of relationships that we had in our lives at Lexington. And we thought Medicare was one of those topics that it was in people's mind. We wanted to get somebody that we trusted a lot with their expertise, but also somebody internally that has dealt a lot with the financial planning side of things. So we thought the perfect two people were whoever was named Susan. So, so we had, from Lexington, we have Susie Boretti Panduku. Susie is a wealth advisor at Lexington, and she deals with a lot of high net worth clients, but very expertise in the financial planning side of things. And let me just stop the video. And then from the Medicare expert side of things, we have Susan Birtwell. Susan works for Kaplan. When we first started planning for this, she was like, I'm not quite the expert. It's like, well, you've been in the industry for more than a decade doing this day in and day out. So that's as good as they come. So thank you so much for your time, Susan.
Thank you.
I had creating and researching this topic today was really hard for me. I am not a Medicare expert, and I was overwhelmed just by trying to figure out how to start asking questions about this topic. And I feel through COVID, a lot of people have also felt the need to start looking at how their healthcare situation is covered for their planning, both from the private and public sector. So Medicare was a conversation that was definitely in my mind and probably in somebody's mind too, in everybody else's mind. Looking at just the plans available in Massachusetts that I could choose if I would be on eligible age, I realized, oh my God, there's more than like 25 different plans that I could choose. And I was like completely overwhelmed by it. So I want to start with a very basic question, Susan. Do you mind just explaining to us kind of like in a 101, what is Medicare and how should I think about it? Because that's what I would like to know.
I'd love to. Thanks for having me. I appreciate being here. Medicare 101 would be my basic conversation I have with a lot of our clients. Mm-hmm. Basically, I just kind of want to talk about the different parts of Medicare, how you would enroll. Give me like 2-3 minutes and then we can delve deeper in. But Medicare Part A covers hospitalization benefits, and it covers it pretty much in full with the exception of a deductible. Medicare Part B covers outpatient services, and that would be doctor's visits, lab work, ambulance trips, CAT scans, x-rays, any of those, mental health provider visits. All of that would be covered under outpatient services under Part B. And Part B, you pay Part B covers 80% of all the costs. And for Part B, you pay the government a monthly premium, and that premium is based on your modified adjusted gross income from 2 years prior. And that's, I think, for a lot of what Susie can be of a tremendous amount of assistance with in determining where you are. But that's a set number. And if your income, if you were filing individually, if your income was under $87,000 in 2018, or jointly under $174,000 a year, you'd pay the minimum price, and that is $144.60. Your income, if your income is deemed higher than that, you'll pay, a higher monthly premium. And then they also, Medicare also provides an item called IRMA, which is a Part D RX coverage adjustment fee, and it's assessed to high income earners. Earning over $174,000, that was me, that beep, sorry. And earning over $174,000 a year would also be assessed this high income earners called IRMA. And there's
one of the things that I was very confused or that I think you can probably give me a little bit more insight on, like the big differences when it comes to premiums with Medicare Advantage and just having supplemental plans. So do you mind like explaining that difference?
Sure. So when you talk about, so as I was saying, Medicare Part B covers 80% of your services. So you need a supplement plan or an advantage plan, or sometimes they call it a Part C plan to cover that gap, that 20% gap. So in that gap, advantage plans work like an HMO plan. If you pick a primary care doctor, the primary care doctor refers you to specialists, you stay within a network, you pay a flat fee for a advantage plan. You could pay anywhere from $0 a month to upwards of $200 a month, depending on the plan that you pick. The majority of all of these advantage plans are HMO plans, where you have a primary care and they provide you with referrals. There are some PPO plans available, which allow you to use out-of-network services, which can very well work well for a lot of people. And you would pay a flat fee to the advantage carrier. You would probably have some payments for doctor's visits, lab work. If you had hospitalization, it might have some deductibles. There's a lot of those HMO advantage type plans on the market, HMO and PPO advantage plans on the market. The other type of plan that you could have to supplement that gap of Part B would be a supplement plan, a medical supplement plan. Medical supplement plans cover, as long as you see a doctor that accepts Medicare and the service is approved by Medicare, your costs are covered. It should be covered in full with the exception of the Part B deductible, which is $198 in 2020. But all of your services, as long as you see a doctor that accepts Medicare and the service is approved by Medicare, it'll be covered in full with this exception of the Part B deductible. If you enroll in a medical supplement plan, you will also need to enroll in a prescription drug plan. Prescription drug plans are very specific to your needs. Every prescription drug plan, and there's 25 of them or 26 of them in Massachusetts currently, they have to cover it at a minimum of 2 medications per therapeutic category. They cover many, many more than that, but they don't have to cover every prescription. And likewise, sometimes when you're on a prescription drug, it may not be covered by that plan.
Yeah. So let me ask you, and sorry to interrupt you right there, but it's besides the income levels and thresholds that you were describing that will definitely ask Susie on her opinion, what other factors do you consider important when choosing these plans?
When deciding between an advantage plan or a supplement plan, I
Yes.
think I would consider what my lifestyle is like. If I happen to spend 3 months in Florida or, a couple of months here, or go visit my kids and stay there for a month or two, or COVID happens and you go and you're with you.
Yeah.
I do think, that's one of the factors. Employment status would be a factor that I would use in determining what types of plans I would enroll in, what my current health is, and what my prescriptions I need. If you don't take a lot of prescriptions, or if they're all generic, if you take a lot of expensive drugs, it could be very important for you to really select the right plan and the right type of plan. And I think those are some of the factors that you would use.
And this is going to sound almost like a basic question, but I remember when we were preparing for this webinar, I did ask the question, how has COVID affected your decision making at all when choosing these plans? And your answer was like, pretty much nothing.
It doesn't. I mean, these Medicare plans cover everything. It's probably the best health insurance you've ever had, and probably the most reasonably priced. Even if you're at the high end of the spectrum and you're paying an awful lot for Medicare Part B, it's still a very cost-effective plan, although it sometimes hurts to make that monthly premium. But I think I lost my train of thought here. But
so the idea of like having this
so COVID. I'm sorry. So COVID actually, Medicare covers COVID completely. Testing, hospitalizations, all of those things are covered in full on a supplement plan. How it's covered in each individual advantage plan, I'm assuming it's certainly covered. Whether you would have to pay a copay for a doctor's visit would be dependent on each particular plan.
Perfect. And then I would say the last question I might want to ask you, because we can get very detailed, and I'm sure a lot of people will have questions on this particular topic when we open the microphones and cameras. But the last question I want to ask you is like, deciding what kind of benefit or who decides pricing and all that kind of stuff. You were discussing in our prep that depends a lot on between if it's an advantage plan or a Medicare supplemental plan. And I think that was so important.
So one of the things that I mentioned, you're correct. One of the things that I mentioned was The government, if you enroll in an Advantage type plan, the government pays a fixed price every month to that carrier to have you as one of their enrollees or one of their subscribers. And the carrier is then the one that is making the decision whether you're going to take that lab test or, that extra scan or whatever it is that you want to do. In a Medicare supplement plan, Medicare makes that decision. And their criteria is it medically necessary? And so it's a much broader spectrum. I don't know that people actually do have a lot of problems with these carriers, but I do suspect that the carriers are in business. And I suspect that, their decisions are made somewhat, to some degree, they have some monetary background of their decisions.
I wanna bring Susie into the conversation, and before we move more into detail onto Medicare, but from the financial planning side of things, Susie, what role does Medicare play in it?
Yeah, so medical expenses is one thing that we definitely like to discuss when working through a financial plan. We do actually even separate the medical expenses from the everyday basic expenses because we feel or we expect that medical expenses actually inflate at a higher rate than just your normal everyday expenses. So usually when we're doing a plan, one of the higher cost considerations is the private insurance in between retirement and filing for Medicare. And usually once the client reaches age 65 and is eligible for Medicare, their health costs will be lowered and will be more manageable. But each client situation is different. So there's, a client might be a high earner, like Susan said, what types of medications are they on? And does Medicare even cover everything that they need? So that's why as an advisor, we like to help connect our clients with consultants like Susan to help look at a client's, health status or their medications and kind of run a financial comparison of whether or not the Medicare makes sense from there for them. And then from there, we can update the financial plan for a more accurate estimate of medical expenses moving forward.
Yeah, I just to add to that, this is a complicated topic.
It's so complicated. And I think Susan said it. I think Susan said it in one of our meetings. It's such a complicated topic, but it really shouldn't be.
Yeah, but it really shouldn't be. Susie, I wanted to maybe ask you a little follow-up on the answer that you just gave. So it seems that there is a lot of things that you don't have control when you do financial planning, especially for Medicare, like health, like you can have certain control over it, but not 100%. But one of the things that are determined of which kind of premium are you going to be incurring is definitely the income thresholds. And I think when it comes to financial planning, there is some controls that you can definitely do, or some planning that you can do. Do you mind expanding a little bit more on that topic?
Yeah, you're exactly right. When it comes to healthcare and your health, there's only so much you can control. So when looking at it from a financial perspective, you want to be able to control what you can control. And as Susan alluded to earlier, there are different income thresholds that kind of affect what your premium for the Part B Medicare is. So I think she had mentioned that if you're filing single, if your modified adjusted gross income is under 87,000, or if you're filing joint and your modified adjusted gross income is under 174,000, then your premium is limited to about $144. But if it's higher than that, and then even higher than that, those premiums can increase substantially. And I think it can get upwards to almost $600 per month. So when we're looking at that, we do want to kind of take into consideration on your financial side, what can we control? So we want to take a look at that modified adjusted gross income number. And so just to clarify, that modified adjusted gross income, if you look at a tax return, that's your adjusted gross income, which is your income before all your itemized and standard deduction. And then it actually adds back your tax exempt income. So so that is a little tricky. I don't want to use annoying, but it's a little tricky. Yeah. So we do want to manage that from a financial perspective, because we don't want to be increasing your modified adjusted gross income when it's going to not only increase the amount of tax you're paying, but also increase your monthly premiums for Medicare.
What and again, so now I'm getting kind of like the importance of like controlling, or at least having control on and projections of income for this particular topic. But are there any kind of tool sets or resources that you use on a regular basis to do this that you could share?
Yeah, so a couple things. When we're building client portfolios, we do like to keep an eye on where we place assets that have higher income. So, that would be like fixed income.
Okay.
So we would want to put those in tax deferred accounts like IRAs or 401ks, where the income in those accounts don't show up at all on your tax return until, of course, you start taking distributions from them. So when you're looking at a total portfolio, you might want to put those types of assets in the IRAs and the 401ks so that you limit the amount of income that ultimately shows up on your 1040. Another thing that we do, which, we do very well at Lexington, and which we have been doing, for the past 4+ months now, is we've been aggressively harvesting tax losses. Okay. So when there are opportunities to do so, when markets are volatile, we can sell a holding in an asset class that's trading at a loss, book that loss, and then buy a very similar holding. So you're still invested for when the market rebounds, but you book that loss so it shows up on your tax return. And that loss is actually eligible to offset other capital gain income, but it also offsets your ordinary income up to $3,000 a year. And it continues to offset that ordinary income by $3,000 a year every year until all the losses are used. So it's helpful when you're kind of trying to manage income as best as you can, to have those types of things in your back pocket.
One of the topics that came up while we were preparing for this webinar was the conversation about penalties, and it was fascinating for me as an outsider, not super informed on the topic, because from the financial standpoint, sometimes these penalties sound worse than what they are when it comes to the planning side of things. And I think it's very important to like raise those right now, so people have a better understanding what kind of penalties you could incur if you, for example, enroll or don't enroll. So I don't know if you're going to expand on that particular topic of the penalty side.
Me.
Either.
Yeah. So, I mean, the two main penalties are, there's a Part B penalty if you don't enroll in Medicare Part B at the correct time. And that's a question everybody has, and everybody's scenarios are slightly different. We didn't really talk about when you enroll, but there's a lot of discussion as to when you enroll in Part A, when you would enroll in Part B, and then when you enroll in plans. And if you enroll in those plans late, there are penalties. Now, the D prescription drug penalty, there are times when it may be worthwhile to take. The Part D penalty is 1% per month, but that 1% equates to around 33 cents per month. So it might be worth, not taking Part D for 3 years, depending on what your scenario is, and if you have other coverage, it might be worth not taking Part D, assuming, a 33-cent penalty per month for every month you don't have it. Let's say you go 3 years, you're not talking big dollars. The savings that you may be able to achieve in other areas may be more than worth it. But I think those types of conversations, are worth having on an individual basis, because everybody's situation is so unique. And
absolutely.
I mean, I don't want to say complicated, but unique. I mean, everybody has their own set of their own situation.
Yeah, an example of when you might want to delay enrolling is if you are still working at age 65 and you're in an employer-sponsored plan with an HSA. So you're actually not able to contribute to an HSA if you're enrolled in Medicare Part A and D. So,
HSA, do you mind just like explain the HSA, the health savings account?
Yep. So the health savings account is an account that you are eligible for through an employer-sponsored plan, where you are eligible to make up to $7,100 of contributions for a family plan per year. It's a deduction on your tax return, and then any expenses that you pay out of that account for medical expenses are actually tax-free. So you're getting a tax deduction for the amount that you contribute, and then any amounts that you're paying for medical expenses are tax-free. So that's an extreme benefit to have. But if you're enrolled in Medicare Parts A and D, you lose that benefit. So you lose the benefit of contributing to the plan. You're still eligible to use it, you just can't contribute to it. So you lose the tax deduction. So that's just something that you might want to consider when you're looking, if you've reached age 65 and you're in an employer-sponsored plan with an HSA. That's just something that you might want to consider when you're, thinking about delaying and incurring this 1% penalty. But like Susan said, it's different for everybody, and every situation is so unique, and that's why it's important to talk about this.
Correct. Susan, anything you want to add on that particular topic?
No, I think that's complete. Yep.
And before we open the microphones and cameras, we have got some questions that I'm just gonna read them, so maybe you can help me answer.
Do you mind if I just jump in really quick?
Yeah.
I just want to talk about one important planning opportunity for those who are on Medicare but haven't yet reached their age 72, where they're required to take required minimum distributions. So if you're currently enrolled in Medicare and you're receiving Medicare, but you aren't yet taking RMDs or required minimum distributions from your IRAs or your 401ks, that you kind of have a sweet spot for planning. So I just want to talk about that really quick before we move on. So kind of going back to those income thresholds again, if you're single, filing single, if your income is lower than $87,000, your premium is the lowest premium, again, $174,000 for married filing joint. So with clients who have the IRAs or the 401ks, and when they reach age 72, they're going to have to take distributions from those accounts and pay tax on it. Those distributions might actually increase their modified adjusted gross income, and therefore bump them into a higher premium threshold. So if we're 65 and we're not yet 72, we have 7 years to kind of play around with, okay, should we kind of take some of that income now and control the amount of income that we can take in a year? And therefore, when we reach age 72, the distributions from our IRAs might not be as high as they would be if we weren't taking these early distributions. And if you don't actually need the cash, it might be an opportunity for some Roth IRA conversions.
Exactly.
So, clients have, investment income, and taking into consideration all that other income, we can back into an amount that a client can convert from a traditional IRA to a Roth IRA. You're going to pay the tax in that year, but we'll keep it under that threshold, the $87,000 and the $174,000. And then if you do that, a couple of years, 7 years down the line, you might be able to actually decrease your amount of tax deferred accounts so that your RMDs won't be as high, and you'll keep your premiums lower. Yeah. So I just wanted to throw that out there.
No, it's I mean, the amazing thing for me is that it's so variable, but at the end of the day, you need help in not just the financial planning side, but also like choosing the right plan that is completely health related. So it's not necessarily income related. So I think having a team around you adds a lot of value for those that can definitely afford it. So what I'm gonna do now is for everybody listening, I'm gonna, and Chris just joined us, and let me just, I'm gonna actually read the questions that people were putting in before, and then after that we'll open the microphones, open the cameras, and everybody can start asking questions. The first question I think is probably for Susan. Do you mind repeating the difference between, in high level, about Advantage and supplemental plans?
Sure. Typically, an Advantage plan works like an HMO. So HMOs have a referring doctor, there's a network of physicians, and you stay within that network. The majority of Advantage plans are considered are HMOs. There are a smaller portion that are PPOs, which allow you to see doctors in and out of the network. Advanced supplement plans let you see any doctor you want anywhere in the country, as long as the doctor accepts Medicare. Just gives you a lot of wide reaching, a lot of selection. You don't need a primary care to refer you. It's just very easily used. I think the Advantage plan can also be easily used, but your choice of selection and freedom is much greater with the supplement plan.
Awesome. The other question we got is, I'm used to choose healthcare plans for my family, but am I correct that Medicare is an individual base, so it's only for me?
Correct. Medicare is an individual plan. You are no longer a couple or a family when you are on Medicare. You are a single. And you're absolutely right. What one plan might work best for one, and another plan might work best for another. Often I put people on very similar, the same medical supplement plan, but their prescription drug needs are different, and each of them gets their own prescription drug. Regardless, you're going to get, if you went the supplement route and you're a couple, you're going to get 4 bills at the end of every month. One for each of your medical supplements and, one for each of your prescription drug supplements. So you are in Medicare, you become an individual again. You gain your independence.
There is another question regarding premiums, which is, does monthly premiums for Medicare adjust yearly based on the last set of returns, or is it fixed at the year of retirement?
It's based on your modified adjusted gross income from 2 years prior. So on January 1 of 2021, it will be based on your modified adjusted gross income from 2019, and it adjusts every year going back for 2 years.
And if I could just throw in something there, I think Susan and I had a client once who said, what if I sell my house and I have a large capital gain in that year? Will that throw me into a higher premium? And I think, and Susan, correct me if I'm wrong, that there is some sort of, you can almost I don't want to say argue it, but there's an abatement that you can file, and they will, they'll forgive that year so that that sale won't increase your premiums for 2 years forward. So
there is an appeals process that you can use. I don't know how successful that is. A lot of people will end up, selling their company or getting a buyout of their company at the end of their careers with them. Yeah. And, that can impact your income. And I'm just not positive that that's always approved. That's not necessarily always approved by the Medicare appeal process.
Mm-hmm.
Well, so for everybody listening, so I'm going to stop the recording. So feel free to now turn your cameras on, unmute your microphones. We're going to start kind of the open Q&A. So thank you so much, Susan.